to be talking about blood sugar levels and diabetes patient effect on hospital and readmission rates. So this project was designed by me and Jeremy. Jeremy is my project team member. So me and him, we worked on this project throughout the semester on what we want to research on. In this case, we're going to research on blood sugar levels and diabetes effect on readmission rate. So throughout this presentation, I'm going to be talking about what analysis we made and what some interesting insights we found. So let's go ahead and get started. So to start, what is diabetes? So diabetes is a troubling disease that affects the pancreas' ability to produce insulin. So insulin is basically a compound that allows your body to absorb glucose or sugar from the blood. So that basically means that if it doesn't produce enough insulin and sugar stays on the blood, it can cause it can damage the blood vessels, which can lead heart disease, nerve problems, and kidney disease. So for this project, we plan on predicting if a diabetes patient will be readmitted within 30 days based on blood sugar levels, as well as another important variables, as you guys can see listed right here. So what is the problem? So the problem is that hospital readmission rate is becoming very high. It's becoming very high, and the rate is becoming really high because patients are being readmitted within 30 days. And that's mainly because that their blood sugar, and it's mainly because of their blood sugar level. Well, so their readmission rate is becoming really high, and it's affecting like their the way they operate their businesses and the amount of resources they have. And this has a huge impact on the patient's mortality rate, and their and not only that, it's also important because if a patient's readmitted within 30 days, the hospital's insurance will not pay out. And our plan is to basically predict if a patient with diabetes will be readmitted within 30 days based on their blood sugar levels and other important variables. So our question would be asking if a patient has high blood sugar levels, are they most likely to be readmitted to the hospital, and what other attributes are correlated to that. And then that's just our project objective as of what we're looking for exactly. So understanding the data. So this data set that we found was from UCI machine learning, and this data set has over 100 diabetes patients with blood sugar levels and other variables such as demographics, which totals to 55. We actually, me and Jeremy, we trimmed it down from 55 to the 12 core variables, which you will see on the next slide. And then basically we cleaned up the data, we removed some unnecessary columns, and basically just make sure that the data has all the information we need for our research. So we kind of basically work with the data and then basically, asking questions and then, showing what we found. So that's pretty much what we've been doing. And then these are one of the core variables, as I mentioned earlier. So we have the feature name, type, their description, and its values. And then this is just a continuation of what we're looking for exactly. So to start, data analysis, the amount of time spent in the hospital. So for this graph, I designed this bar graph to analyze the the amount of time spent in the hospital, based on their readmission rate. So basically, what I found this interesting thing is that some of the lower numbers, like for example 1, 2, and 3 have a higher readmission rate, and while the time spent in the while the numbers from 10 through 5 through 10 has a lower readmission rate. So I thought that was really interesting thing to do. So what I found interesting is that the graph is skewed to the left side. It increases and then it decreases over time, and it's because it's based on the numbers versus time spent in the hospital. So I thought that was really interesting to find out the amount of time spent in the hospital, which also has an effect on a readmission rate. Next is going to be the number of diagnoses performed. So for this analysis, I designed this bar graph right here. I'm sorry, line graph, and as you can see, this line graph decreases and then increases. So there's like a big fluctuation right there. Sometimes what I like to call, when I see these types of graphs, I like to call them spikes. There's like a increase and then decrease and then increase, and it's not level. So I thought that was really interesting to do. So one interesting insight I found is that, as I mentioned, there's just like a slight fluctuation on that. Like for example, for diagnosis has, I guess you can say about around between 36 and 38, around that. And then it increases and then decreases. So and then it just gets higher. So the number of diagnosis performed has just a slight fluctuation. So, and it's important to know how much lab procedures are there to perform for patients with diabetes, and then just make a note on how it will affect the readmission rate. So I thought that was really interesting. Next is going to be readmission rate by age. So if you guys take a look at this graph, it's kind of similar to the one I showed you, except this one is by age. So what I found interesting is that there is a large percentage of patients ranging from 10 to 100 are not able to readmit to the hospital after 30 days. So, which is the third bar right here. So I thought that was really interesting to make out how to do. So this is like an analysis that I just did to to figure out if patients are being able to readmit to the hospital within 30 days. In this case, these are the age groups right here, and this is mainly because of their blood sugar level affecting and the amount of diagnosis they had to go through. So I thought that was really interesting. Next is the number of diagnoses. This is by age. So similar to the last slide, this time it's going to be focused on the number of diagnoses performed by age. And one thing that I found interesting is that 9 patients that was diagnosed with diabetes has the highest age group, ranging from 300 to 100 years of age, and these patients in these are most likely to have higher diabetes level, and the amount of diagnosis they have also may affect on how many days they because many patients are constantly being admitted to the hospital, but once they get discharged, but if they need to get readmitted, there's a slight higher chance that they're not able to readmit because of their higher blood sugar levels. So I thought that was really interesting. Next is going to be change in medications by race. So for this graph, I designed this graph to analyze the change in medication by race. So based on this, we found me and Jeremy found that Caucasian holds accountable for having the most change and no change in medication to see if their blood sugar have been improved. However, other race and Hispanic and Asian holds accountable for being the lowest and no change as well. So depending on, for no change at wealth out of these race, they most like if their medication did not improve their blood sugar and it's still high, and their blood sugar is still high, then this may also affect their ability to readmit into the hospital as well. Um, so I thought that was really interesting to do and make analysis about that. So I thought that was really interesting to do. And then statistics. Basically on this slide, we just basically made statistic analysis on this on analysis that we made through researching. So, for example, discharge disposition with a race of p-value of 1, medical specialty of admitting physician of 1, and so on. So I thought that was like really interesting to make analysis about that. And then right here is just a description below of what we found through our research, and then just making assumptions about it. So I thought that was really interesting to do. And then what we learned so far from doing this project is that we definitely learned a lot from analyzing blood sugar level and its impact on hospital readmission. This is something that it's really important because hospital readmission is very important because hospitals have a lot of is a very busy business because they have a lot of resources and a lot of patients that they need to take care of. So the more patients that they have to be admitted to hospital, the most likely it'll affect their businesses, because if they run out of resources such as medication or tools that they need or anything like that, then they might have trouble acquiring those tools. So that's why it's really important for hospitals to have a low readmission rate, so they can able to operate their business efficiently and also provide resources available for patients. And this is something that's really important for hospital businesses to do. And that way we can able to make assumptions about it, make analysis on that as well. And then these are just some references that we use for our project. So those are just the resources that we use for the project, such as the data set that we use, as well as the information we have on our PowerPoint presentation.